Hello, my name is Dr. Lester Hartman. I'm a pediatrician who's been in practice for 25 years. Today I want to demystify or discuss the fallacies about strep throat and the concerns that parents often have about why they need to get into the physicians immediately when their child has a sore throat. Basically, strep is a bacteria specifically called group A strep. That is a bacteria that gets into your throat. It's contagious, often between the ages of 5 and 16. Kids get it. And it causes a sore throat, fever, and difficulty swallowing as well. There are many other things that can mimic this as well. So it's very hard to distinguish between viral and bacterial sore throats. So today we're going to teach you, in addition to learning about strep, about how to even do the strep test yourself. First of all, what is strep? Strep is often referred to as the cause of strep throat, but the true bacteria which causes strep throat or tonsillitis is called Streptococcus pyogenes, or group A streptococcus. Why do we treat strep? Listen very carefully, please. The major reasons are more for rapid pain relief and to reduce contagiousness to children so children can return back to school quicker. On rare occasions, and in my 25 years in practice in Westwood and Mansfield, I have never seen this, but rheumatic fever can occur. In fact, we've spoken to the children, the largest pediatric cardiology clinic in the world. They only see 3 to 4 cases per year. The only case I have seen is in Cambodia, and the major risk factors nowadays are poverty and overcrowdedness, oftentimes which occurs in developing world countries much more than in the United States. And in order to get what's called rheumatic fever, which is the fear that parents have if their child doesn't get treated immediately, takes 7 to 10 days for you to actually, from the time of getting a sore throat and fever to the time of getting rheumatic fever, which means that you have to have those symptoms for 7 to 10 days, which is very rare that families will wait that long. Henceforth, even if you did a strep test yourself and it was missed, if you're seen within 24 or 48 hours, then you could get a different result maybe and be treated quickly and well within a timely fashion. The other thing is people have fear about scarlet fever. Scarlet fever is basically just a rash. It does not cause heart disease. It does not damage the heart. But what it does cause is a rash, oftentimes fiery red in the groin area, red in the creases, and light red on the skin, and feels like sandpaper. That's easily treated just like any other group A strep infection. And you treat it with antibiotics, a penicillin-like drug, and it will cure the problem. Remember, only 30 to 40% of people that go into an office to get a strep test are actually positive. 60 to over 70% of people who go in for a strep test will be negative. So those are the issues around strep. Again, it's fever, difficulty swallowing, a beefy red throat, if you can see it with a white light, red spots on the soft palate in your mouth, which the next video will explain better, and occasionally white spots on the tonsils, but that's far less important. So please remember that strep causing rheumatic fever is extremely rare in the United States, and that we don't really treat predominantly because we're preventing rheumatic fever, but rather to relieve the pain in children more quickly. Thank you very much.